Hi everyone. So we are back again talking about the COVID vaccination program, as promised previously when only a couple of weeks ago we were talking about flu. So we're here tonight to talk about what we know so far about the COVID vaccine booster program. So that's all those people that are expecting to have their third dose. We're going to be talking to you about who is entitled to have their third dose, who we should be vaccinating next, and what we should be doing. So tonight, and Stuart, can you just move to the next screen? You have myself talking again tonight, and also Dr. Chet. So let's give Chet a little wave. It's going round and round.
Hi everyone.
Cool. Okay, so you're back with me again. So Chet's here to answer kind of the clinical questions that you may have about which vaccine, what, how and when. Okay, and I'm going to talk to you about the general aspects of what we know. So Stuart, can you move on to the next program, please? Remember, and I just do a recap on live events, you can ask questions throughout. I have my questions showing to me, so as you ask questions we should be able to answer them maybe as we go or definitely by the end. So remember, no question is a silly question. Please do ask, but check your questions prior to posting to make sure nobody else has asked it. If they have, then just like it and we prioritize what we're asking or what we're answering when, to make sure that we get to all of you as quickly as we can. So I'm just going to wait kind of a couple more minutes. We've got 95 of you online with us, which is excellent. And as soon as we just give it a minute or so, make sure everybody is in, and then we'll move on to the next screen. So Stuart, can you move to the next screen just because it's a holding one? Okay, fab. Just wait for the time. Okay, remember, post away about any questions that you have. So that minute is now passed, so let's move on to the next screen. Fine. So what we know, okay, we know that people who were in cohorts 1 to 9, so that's basically everybody over the age of 50 or those who were deemed clinically extremely vulnerable previously will be able to have their third booster with us this winter. Okay, that is what the plan is, and NHS England are allocating vaccine for you to be able to have your vaccine with us. So we're having that third vaccine in. We also, those volunteers who we vaccinated with their first and second vaccine, if they come back and volunteer with us again, then we'll be able to give them their third vaccine as well, because they'll be helping us to deliver the programme. What's really important with the timescales of this is that that third booster can only be given after 180 days of your second vaccine. Okay, it can be given later, but it can't be given any earlier than 180 days. So just to put that kind of into concept here, if you had your second vaccine on the 2nd of April, and I know a lot of you did, remember, the earliest you can get your booster is the 29th of September. Now, from what we understand, it's important that you get vaccinated with your third vaccine before the 31st of January 2022. So that's what we're working towards. So please don't worry that, hang on a minute, I haven't had my vaccine on the 29th of September or shortly after. NHS England are working through the numbers throughout the country of who needs vaccinating when and trying to get that vaccine to us. So that's the first part to share with you that we definitely know. The next bit will be in terms of how we're being invited. Like we did before, we're using the same system. So you will receive a text message from us to book your appointment, and it will be at Larkhill. Okay, if you do not have text messaging functionality, then we will be sending you a letter or phoning you to invite you in. Okay, so we'll be doing that. That takes a little bit longer, so you'll find that you might get an invite later than those people that are receiving text messages, just because texting is, instantaneous from our end. We know that we're going to be vaccinating from Larkhill again, so you'll be vaccinated there, but we can vaccinate people at home, and we're looking to try and combine when you have your flu vaccine and having your COVID-19 booster at the same time. That may not be possible, but that's what we are trying to achieve. And there is only going to be one vaccine available, and that's the Pfizer vaccine. So regardless of whether you had AZ, your AstraZeneca last time for first and seconds, Pfizer is going to be your third vaccine for your booster. Okay, that is what is happening so far. Okay, so that's what we know currently. Now I'm just going to check what the question is. So we've had one question here, and I check, this is a question for you. So please can you explain the benefits of getting a third jab? This particular patient is in group 6, otherwise healthy apart from a health condition, and will get the flu jab. But is it really necessary? We only get a flu jab once a year as a vulnerable person. They'd like to know our views on it, and it was interesting to get your view rather than the motivations of the politicians, particularly as other countries haven't had any as yet. So sorry, the screen's just going over to Chet.
Wow, good question. A tough one to answer. I'll give you the sort of viewpoint of why we're going for a third vaccine. At the moment, we feel that after 6 months or so, we are really unsure on the level of immunity that you get with the 2 prior COVID vaccinations, as they are so new. We are expecting a severe increase in COVID cases with flu to be occurring over the winter, and already the NHS is kind of under pressure at the moment. So what the plan is, I can see from the politicians and from the joint committee of immunisations, is if we can vaccinate people to make sure that their level of immunity covers the winter with the flu vaccination, then hopefully we won't end up with such a high death rate or hospital admissions. The second thing to say is that people that are double vaccinated are being admitted to hospital. However, we know a bigger proportion of those aren't getting a genuine response. So there is a level of immune uptake by some of the vaccines. So we are unsure whether you have developed a suitable response or not. Therefore, by giving you the third dose, we're kind of covering that off. So at the moment, I can't see the third dose being given to anyone below the cohorts 1 to 9. Of course, it really depends on availability of stock and where we're at. We do see your point that the rest of the world is nowhere near to being vaccinated like we are in the UK. And it would be better if we were to share more and more vaccines with them. That's one of those things that we have very little power over, and that is in the hands of the MPs and everyone else. But I suppose we can only do what we can, which is why we've delivered such an amazing vaccine programme from the start of the year and got through over 80–90% of the population, to keep us in a position whereby we are relatively open as a community and hopefully not looking to shut down. So I hope I've answered that question over a multitude of different ways, and hopefully we won't see the winter that one predicts. Back to you, Anna.
Thanks, Chet. Now, Jill's asked, if my flu and booster are around the same time, can I decline having them at the same time? No, you can't. The flu vaccine is, you get an invitation electronically or in letter form. You need to decline that one if you don't want to. And then again, when the COVID booster invitations come out, again, you can decline that one. They are separate invitations. We don't assume because you don't want one that you won't want the other. And therefore they're separate. So you will need to decline both. But like we say, we don't advocate that for neither the flu nor the COVID vaccine to be able to do that. to look at. Now, there's somebody just asked a question about their first and second vaccine. I can see that Chet is actually messaging you directly at the moment, so I won't ask that one at the moment. But actually, somebody else has said, will appointments for the third jab definitely be kept? Last time I had my jab and turn up, and there were lots of other people in the queue. So no, there is no. There won't be any leftover vaccine. We will be given the vaccine for you. There won't be any leftover. This is only the booster program. So you need to keep your appointment, and there won't be any more additional people coming into that program as we stand at the moment, because it is only the booster, and therefore it's for those people who have had first and second vaccine and are 180 days past the date of their second vaccine to be able to have their third, to be able to do that. So hopefully I've reassured you about that. So when you say the 22nd of March, we're then looking forward at 180 days. So that's looking at roughly, what would that be? Roughly now, this week now, in terms of those things. Now, we do not have that COVID vaccine. And if I go into that discussion in the next point, I think that that's relevant. So can we go to the next screen, Stuart? Okay, so this is what we anticipate. We have not been able to order any vaccine at the moment. All we've been able to do is request how much vaccine we need to be able to host the various different appointments as such for you to be able to have your booster. So we've made a request for just over 1,400 vaccine to be delivered in time to vaccinate you all in your first kind of groups on the 2nd of October. That gives us scope to vaccinate all those people who were second jabbed in February and March, plus the 2nd of April. That was our last date. And if we've got some left because people don't want it, what's going on, then we've got our next date that happened on the 9th of April to be able to absorb some of that shortfall accordingly, and we can monitor that as we go. So this is not a confirmed date. This is an anticipatory date for you, that should we get our delivered vaccine as we hope, as we've requested, then that's the dates that we're looking for. Again, those people that were vaccinated in October, we'll be looking to vaccinate you on the 13th and 14th of November. Oh, sorry, those of you who were vaccinated with your second vaccine in April, latter part of that from the 9th onwards, we'll be looking to vaccinate you on the 13th and 14th of November. And those people that were vaccinated in May with their second vaccine, we're looking for the 27th of November and the 4th of December. But like I've said, this does depend on us receiving the vaccine from NHS England. We've made our requests, we've put forward our plans, but of course they do have to be approved, they do have to be looked at, and this is across the country to be able to do that. And of course NHS England have the job of having to allocate these vaccines to everybody, every group who are vaccinated, to try and get to people in a timely fashion to be able to do that. To be able to do that. Oh, right, okay. And another important part is somebody says, I received my jabs at City Hall, and will I still get a text from you to get the booster? Yes, you will. If you're a patient with us, we'll be looking to invite you in as well to have your third with us at that time. To be able to do that, because it is based on who is registered with us in the first kind of position. We know other people that were vaccinated with us that are not patients. However, we know who they are, and we will be going out to contact them as well. However, those that have left the area will probably be invited by their new practice if they've registered, and moved to Yorkshire, for instance. Okay, so I'm just going to have another look at the questions. Chet, I'm just looking at you right now. Is there anything that you want to say while I'm having a look at the questions? Shake your head or nod for me.
The Paula question, can you hear that?
Okay. Oh yeah. So do you want to answer that one? So Paula says, I'm currently in cohort 6, but not currently eligible for a free flu vaccine. But will this automatically be given to me with my third? Chet, so over to you to answer that one.
Hi, a really good question. For a start, we're not co-administering flu and COVID vaccinations. I want to make that really clear for a lot of the attendees on this. The only time that we see fit to be co-administering is if we're going to a housebound patient where it makes sense, we do the vaccinations together. So we are really trying to do the flu vaccination with all the other flu, so we don't mix up the vaccine when we're giving to you, and then doing the COVID vaccinations. Now, the flu vaccinations, currently we're working on our most vulnerable downwards for the flu vaccinations, and those invites have gone out. Again, there's been, as you may be aware, there's been a national delay due to the delivery of it. So we're eagerly awaiting our first tranche. And at the moment, we've got enough for the high risk vulnerable patients on our registers. And of course, if the government guidelines changes that we can administer flu to any other cohorts, and we have the supply, of course, we'll be going out to those. So for the time being, if we could just separate the two out, the COVID vaccination criteria and the groupings are very different to the flu. And this conversation is that if you were in the 1 to 9 cohorts and you've had the vaccine, double vaccine, we'll be giving you the third vaccine. As for flu, more and more guidance may come out due to the supplies. We may be producing more and more information about that as we go along. Over to you, Anna.
Thanks, Chet. Okay, so while that's been ongoing, we've had somebody else say, I received my second jab on April the 1st at City Hall. When will I get the booster? So obviously 180 days pass, and I think you get to the 28th of September from memory. That means you can have your booster after that date. So after the 28th of September 2021. Now, as you know, our vaccines, we haven't received any yet. We're looking to offer our first clinic on the 16th of October. So therefore, we'll be looking to invite all of those people who are due at that time, having had 180 days past, in order of when they had their second vaccine. So the earlier you had your second vaccine, you will be on our first invitation list, and we will go through chronologically. Somebody else, Linda, said that she's out of the area until the 12th of October to be able to do that. So when you say out of area, does that mean you're still in contact with your practice? If you are, then of course you can still book an appointment for your third vaccine with us and be able to attend that. We are not looking to hold a vaccine clinic before the 16th of October. We don't anticipate that. It may happen, but I very, very, very much doubt that. So I do believe that the next our earliest clinic will be the 16th of October on that front. Virginia said, I volunteer at Deviser's vaccination clinic. Can I get it there? Maybe. I don't know the setup of the Deviser's vaccination clinic to be able to do that. If you are in cohorts 1 to 9, remember over 50, clinically extremely vulnerable, and you're volunteering, then I can't see why not, but that's not my decision. That's the decision of that vaccination centre who are running that particular programme. Okay, let's go on down to look at some more. So in terms of that, so somebody else has said the anticipated dates you are showing on the screen do not fit for me. What is plan B for those who work at weekends? At the moment, because of the way in which the clinics are delivered, they are centred around weekends to prevent there being disruption to care Monday to Friday. Remember, we still deliver your medical care and all the other things that are not around the COVID booster programme on a day-to-day basis. So it's about balancing all our requirements. I don't know what the booster programme is at what was mass vaccination centres. I'm just going to look at Chet. Do you know, Chet, what the programme is? No, he's shaking his head. We don't know what's happening from the mass vaccination centre perspective. So we can't comment on that. I'm really sorry, but we don't know that. But that's what we're looking at the moment, are these particular dates on that front. So I'm sorry about that, but it is a balance of making sure that we're here and being able to deliver care for all of you, for all aspects of your health, not just the COVID programme. And that Vincent said, we had our 2 jabs when living elsewhere but moved to Upavon and joined the surgery in May. Will we be contacted by your surgery for this booster? Yes, you will. So you'll be on our list to contact, and again, according to your dates, we will invite you according to your dates. Remember, no earlier than 180 days. It can be later. We have signed, as I've said in our flu programmes previously to deliver the COVID programme from the 1st of September to the 31st of January. Therefore, we anticipate vaccinating everybody with their 3rd booster by that date. Okay, again, if the government decide to change that date for vaccine delivery, etc., that's beyond our control, but that's where we are currently kind of positioned. So yes, we've tried to tell you everything that we know and everything that we anticipate. It's one of those things, it's not set in stone. We don't know, but we wanted to share with you as much as we know, like we did previously, so that you have an idea of what is planned, what is in the pipeline, to be able to be abreast of what is going on in the community. I'm just looking down, I can see there's another question being asked. So this has got a patient name in this question, so we won't post it. But somebody says, could their mother please be allowed to have both her COVID booster and her flu jab first ever at the same time at home? Dr. Chet knows her well. Okay, so Dr. Chet is just replying individually to you on that one. Okay, to be able to do that. Right, so are there any other questions? Because indeed we have told you all that we know and all that we anticipate. Anybody got any questions about why it's Pfizer? And did you know that Moderna is coming out as being the vaccine that's being delivered for people needing their 1st and 2nds as well? That's just another bit of interesting information. Okay, so no more questions. So I hope that that means that in effect, what we've done is cover everything that you wanted to know. All right, so again, let's just recap. So Stuart, can you just go back to the screen that says what we know, just to have a recap for everybody? Okay, remember, in terms of cohorts 1 to 9, it's over 50, it's everybody aged over 50, clinically extremely vulnerable. That means somebody's just posed a question asking, is it, does that include carers? Yes, carers were in cohort 6 last time, so you are included in this programme to be able to do that. Remember, make sure your medical records continue to be up to date. If you had your 1st and 2nd vaccine for a different reason, and now your reason for having a 3rd or booster has changed, please make sure that you have updated your medical records, such as being a carer, to be able to do that. Somebody's asked, now this is a question for you, Chet. I had to have AZ due to allergies, so will I be able to have Pfizer? Good question.
Hi, it's a really good question. What we know, the data from both vaccinations, is that they're both relatively very safe. The ingredients in them are very small amounts, and actually we thankfully have had very few, if none, reactions. What I would say to you is, not knowing your particular medical allergies, it may be worth you getting in contact with your surgery once we release the dates, to see whether you would, you would be fine with it. Majority of the patients would be fine with it, but as you're going out to find the patients, it would be worth you contacting your own surgeries. Back to you, Anna.
So next question, and I'm going to pose it back to Chet. So Linda's asked, why is it Pfizer and not AstraZeneca? So do you know why the booster program is about Pfizer and not using AstraZeneca?
Another great question. I think one reason is that the government did buy an extra 60 million doses, so we've got a lot of Pfizer. The second thing is that what happened recently with the change in guidance, we were unable to administer AstraZeneca vaccine to below 40-year-olds. Now, of course, if you look at these cohorts, they include the clinically vulnerable, which are a mixture of your below 40-year-olds. Therefore, you're safer. We are safer because we're the ones giving you the vaccine to give you Pfizer, because it's eligible for ages now from 12 upwards. So it's a safer vaccine for all age groups to give. So I think that is the main decision of why it's become the third booster. Back to you, Anna.
Thanks, Chet. So Anne's asked what minimum period is recommended between flu jab and COVID booster. Well, we do know from previously it was always 7 days from any vaccination to having the COVID booster. We know that in terms of what happened previously. We've had a special kind of mandate that we are able to vaccinate people who are housebound with the COVID booster and the flu jab at the same time. Chet, is there any update on that in terms of the Green Book about the minimum period between flu jab and COVID booster?
Hi, the Green Book's been updated that we can co-administer the two together. However, due to there being difficulties in ordering both vaccinations, I think I think we need to be giving it to you when we can receive it at the earliest possible time. However, in the housebound patients, because it means going out to do 2 visits and the rigmarole of arranging it all, we will be giving dual vaccinations of flu and COVID vaccinations to all our housebound patients, just so that it's a lot easier to administer and it's better for the patient. Back to you, Anna.
Thanks, Chet. So another question being asked was, will clinics have social distancing as I'm on anti-rejection drugs after transplant and have them shielded at home apart from appointments? So we will maintain the 2-meter distancing. As you've been before, you can see the dots that go on the floor. There are times where we are closer than two meters due to the various different stages of the process that we need to move you through for, but it is minimal contact of less than 15 minutes. The chairs are allocated at 2-meter distancing. It's why we're capped at 36 people in the waiting room for waiting the 15 minutes post having the vaccine. So that is also in our programming about what we do to be able to do that on that front. Now, somebody else has also asked, will the surgery put me into the 16th of October group if I was vaccinated on the 1st of April before? So like I said, you will be in our first cohort group that we've got that we identify could have had their booster in September, and we will be moving in slightly into October. However, it is based on chronological order, and it is based on how much vaccine we actually receive from NHS England in one go. So we will be moving through our cohorts chronologically according to when you had your second vaccine, and then moving forward on that. So that is what we will be working through as a process to be able to do that. Now, if we have some vaccine left, we'll move to the next date, and it may well be a first come first served basis depending on the time scale of which we need to operate in. But that all depends on when our vaccine comes, when we're told it's coming, so that we can plan accordingly. Okay. Now, there is one question about NHS opt-out, and it's absolutely fine, whoever asked that, to ask it. But before I go into something else, I'm just waiting to see if there's any more questions. We've got 2 other ones here. Okay, oh, they've just been moved over. Let me just have a look. So somebody says they're having their flu jab on the 14th of October. Can you still have the booster on the 16th? So on the basis of what Chet just said in terms of the dialogue, there isn't the 7-day window that's required anymore. So there shouldn't be any reason why you can't have your vaccine on the 16th. Okay. Oh, we've got another question just in, I think. Oh, no, that's the first one there. Okay. Any other questions before I talk about NHS opt-out? Okay, so I'm just going to talk about NHS opt-out very quickly and then see if there's any more questions about COVID, the COVID booster programme, and then we can go from there. So the NHS opt-out programme, do you remember we talked about that? Oh, that must have been, I can't even remember when that was now. I want to say June. Because they gave a very quick deadline to say you had to have submissions and things in place to opt out. We sent round further information, I know, from Avon Valley practice. I don't know about Sarum Health Group, about the extended date to the 1st of September. That has now started. If you have opted out of the NHS what's it called, the GT general practice data extraction on that front, then of course your data has not gone over to being analysed for research purposes. But if you haven't, then it has. You can change your mind at any time. Go to NHS Digital and you can find out more. Okay, so that's where we're up to on that particular programme. Sorry to be as general as that, but yes, opt out if you don't want to be part of that, or stay in, but you can change your mind at any time. Okay, so I haven't had any more questions, or I should say we haven't had any more questions about the COVID programme. So we'll close it at that point. I hope that you found it useful. Like I say, we always try and plan and update you as best we can on what's happening. We'll see some of you at our flu vaccine clinics that start on the 9th of October. And by then, we would very much hope, we anticipate that we will already know what's going on with our COVID booster programme by then. But like I say, we're doing our best to keep on top of things, to know that what we're doing and our best plans about communicating with you. So take care, stay safe, and we'll speak to you again soon. Thank you.